Hi, my name is Jordan. I'm Dr. Tal's nurse, and today we're going to be going over your pre-op instructions. We're going to go over the instructions for your upcoming gynecomastia surgery, and we're going to start with the medications that will be prescribed. These will be prescribed when you come in person for your pre-op appointment. You'll give me your pharmacy of choice, and I will call them to that pharmacy. So the first medication is the only one out of the two that you actually have to take. It's an antibiotic just to prevent any infection after the surgery. If you have no allergies, the antibiotic that will be called is Keflex. It starts at 10 p.m. the night that you have the surgery, and it's every 8 hours around the clock until it's gone for 1 week. If you have an allergy to penicillins, we'll be calling you doxycycline, which is every 12 hours. When you take these medications, just make sure you take them with food so they don't upset your stomach. The second medication is Zofran. It's an anti-nausea. It's just 2 pills. It's there if you're nauseous from the anesthesia. If you are going to be nauseous, it usually only tends to last the first 12 to 24 hours. So if you're nauseous, you can take the Zofran every 8 hours as needed. If not, you just get rid of it. For this procedure, we don't prescribe anything for pain, so just make sure you have some extra strength or regular Tylenol in the house just in case you need it. But remember, Tylenol is the only thing that you can take for pain. No Advil, Aleve, Motrin, aspirin, or anything like that, just Tylenol. Now, aside from those medications, the only other things that you can take, unless we discussed something otherwise, is vitamin C, 1,000 milligrams a day, and Tylenol if you need it for any reason before or after the surgery. You can also take arnica for bruising and swelling, but other than that, you need to check with our office about anything else. You also want to avoid any herbal teas or herbal supplements, and then 1 week before, no caffeine and no alcohol. If you drink a lot of caffeine, you want to try to kind of taper down off of it, so by the time you get to 1 week, you're having nothing. You will also need to make sure from here until we tell you otherwise that you don't do anything that could cause an infection. This includes things like manicure, dentist, facial, lasers, anything like that you'll need to avoid before surgery and after. Our office will tell you when you can resume anything that we had you stop and when. The night before surgery, no food or water past 10 p.m. You brush your teeth in the morning, but that's it. The night before and the morning of, you're going to take a shower and wash really well with antibacterial soap. Don't apply any lotions, colognes, deodorant, anything like that. If you wear glasses, not contacts, and you'll need to wear something very comfortable, something like a sweatshirt with a zipper up the front or a button up, and then bottoms and shoes that are easy to take on and off. Nothing you have to raise your arms to put on, and nothing you have to bend over and struggle to pull up, just loose, comfortable clothes. You'll need to remove any jewelry and piercings and leave them at home. Somebody needs to pick you up from the surgery. They will not release you alone, and somebody needs to be with you for at least 48 hours. It's recommended for longer, closer to about a week, but at the very least, 48 hours, somebody needs to be with you, and somebody needs to bring you to your first follow-up appointment. That's anywhere between 3 to 7 days after the surgery, and someone should come with you to that appointment. Your second appointment, you'll be okay to come alone. After surgery, you'll come out with dressings and an A-strap wrapped from about underneath your armpit to about your belly button, and then with 2 skinny little tubes coming out the bottom with the drains. You will leave those dressings on and we'll take them off in your first follow-up. The drains, you will need to keep track of how much drainage you have. We have a video linked below, a YouTube video that we found that does a pretty good job of explaining the drains. The bulb of the drains will look something like this. It will be squeezed for the suction, and then there'll be a skinny little tube coming out the bottom. That's what will be going up underneath your dressings. So first thing is first, if you have pets or children or anything that's going to jump up on you, keep them away from you. You don't want to get the drain pulled out of place. It's not going to be very comfortable for you, and it will not do its job. So you'll need to keep track of how much drainage you have whenever you empty it. To empty it, you will open the drain like this. It will expand, and you just write down about how much drainage you have every time you empty it, and then you dump it out. And before you close the nods, you need to squeeze and close like that so it creates the suction. Anytime you empty the drain, you'll need to write down on your phone or a piece of paper the day, the time, and how much drainage you have. Starting after the surgery, you can empty it whenever you feel like it's full. You just keep track of it. But sometime before your first follow-up appointment, we should know how much drainage you have in a full 24 hours. So if you can, try to hold off on emptying the drain until at least 24 hours, at least one time before you come in for your follow-up, so we know how much drainage you've accumulated. We can only take the drains out if you have less than a certain amount in that time. Either way, Keep track of it, write it down. If they're too full to wait a full 24 hours, that's fine. Empty it, just let us know. I will also be giving you a packet of written instructions on what to do with the drains. You'll have to make sure that you read through that packet and have whoever's taking care of you read through that packet before your surgery. When you come in for your first follow-up, most likely, depending on the drainage, we will take off your dressings, take out the drains, add a small dressing over top, and fit you for a compression garment. That will be just a tight compression tank top that you can wear under a t-shirt. You'll wear that for 4 weeks, 24/7, and then an additional 2 weeks just at night. For the first week after the surgery, you don't pick up anything heavier than a glass of water. You'll keep your arms close to your sides. You can move your shoulders around and move your arms around, but you won't really move them past your sides until we show you how to do the stretches in your first follow-up appointment. For the first week, you'll sleep in a reclined position, a couple pillows behind your back, couch, recliner, whatever's most comfortable for you, but you can't sleep flat until 1 week. And for the first week, you can't actually get into the shower, so you'll wash your lower body, wash your armpits, but you can't take a full shower until 1 week from the surgery. You'll also need to do lymphatic massages. We will guide you on when to start. It won't start until after your first follow-up appointment, but these lymphatic massages will help break up the scar tissue after the surgery. Dr. Tal usually recommends between 5 and 10, and you'll just need to make sure you go to a good lymphatic massage facility that works with post-surgery patients. In your first follow-up, we'll review with you the stretches that you'll need to do to get your range of motion back. We'll review with you the lymphatic massages. And then 2 weeks from the surgery is when you can start to use a scar cream. If you have any questions, just call our office or email me. I have my email here. And we look forward to having you for your in-person pre-op and for your upcoming surgery.